My name is Suraj Kadam and today we are discussing about analgesics. Analgesic is a drug also called as pain reliever or painkiller is a member of the group of drugs used to achieve relief from pain. This is analgesia or pain management. Analgesics are conceptually distinct from anesthetics which temporarily reduce and, and in some instances eliminate sensation. Although analgesia and anesthesia are neurophysiologically overlapping and thus various drugs have both analgesic and anesthetic effects. Ingredient for the class of analgesics called opiates. Analgesics choice is also determined by the types of pain. For neuropathic pain, traditional analgesics are less effective and there is often benefit from classes of drugs that are not normally considered analgesics such as tricyclic antidepressants and anticonvulsants. Various analgesics such as many NSAIDs are available over the counter in most countries, whereas various others are prescription drugs owing to the substantial risk and high chances of overdose, misuse, and addiction in the absence of medical supervision. The next one is the classification of analgesics. Analgesics are typically classified based on their mechanism of action. One of them is paracetamol, acetaminophen. Paracetamol, also known as acetaminophen or APAP. APAP is a medication used to treat pain and fever. It is typically used for mild to moderate pain in combination with opioid pain medication. Paracetamol is now used for more severe pain such as cancer pain and after surgery. It is typically used either by mouth or rectally, but it is also available intravenously. Effects last between 2 and 4 hours. Paracetamol is classified as a mild analgesic. Paracetamol is generally self as recommended dose. The next one is NSAIDs. No, NSAIDs is the non-steroidal anti-inflammatory drugs, usually abbreviated to NSAIDs, are a drug class that groups together drugs that decrease pain and lower fever, and in higher doses decrease inflammation. The most prominent members for this group of drugs, aspirin, ibuprofen, and naproxen, are all available over the counter in the most countries. The next type is COX2 inhibitor, means COX2 inhibitor. These drugs have been derived from NSAIDs. The cyclooxygenase enzyme inhibited by NSAIDs was discovered to have at least two different versions, COX1 and COX2, that is COX1 and COX2. Research suggested most of the adverse effect of NSAIDs to be immediate to be mediated by blocking the COX1 constitutive enzyme, with the analgesic effects being mediated by the COX2 inducible enzyme. Thus, the COX2 inhibitors were developed to inhibit only the COX2 enzyme. Traditional NSAIDs block both versions in general. These drugs, such as rofecoxib, celecoxib, and etoricoxib, are equally effective analgesics when compared with NSAIDs but cause less gastrointestinal hemorrhage. In particular, after widespread adoption of the COX2 inhibitors, it was discovered that most of the drugs in this class increase the risk of cardiovascular events by 40% and on average. This led to the withdrawal of ropecoxib and valdecoxib and warnings on others. Etoricoxib seems relatively safe with the risk of thrombotic events similar to that non-coxib NSAID diclofenac. The next one is opioids, morphine, the archetypal opioid, and other opioids, example codeine, oxycodone, hydrocodone, dihydromorphine, and petidine, all exerts a similar influence on the cerebral opioid receptor system. Bupra- bu- Buprenorphine is a partial agonist of the ultra-opioid receptor, and tramadol is a serotonin neonephrine reuptake inhibitor SNRI with weak opioid receptor agonist properties. The next type is alcohol. Alcohol has biological, mental, and social effects which influence the consequences of using alcohol for pain. Moderate use of alcohol can lessen certain types of pain in certain circumstances. The majority of its analgesic effects come from antagonizing NMDA receptors similarly to ketamine, thus decreasing the activity of the primary excitatory means signal boosting neurotransmitter glutamate. It also functions as an analgesic to a lesser degree by increasing the activity of the primary inhibitors neurotransmitter and GABA. Attempting to use alcohol to treat pain has also been observed to lead to negative outcomes including excessive drinking and alcohol use disorder. The next one is cannabis. Medical cannabis or medical marijuana refers to cannabis or its cannabinoids used to treat disease or improve symptoms. There is evidence suggesting that cannabis can be used to treat chronic pain and muscle spasms, with some trials indicating improved relief of neuropathic pain over opioids. And the next is combinations. Analgesics are frequently used in combinations such as the paracetamol and codeine, preparations found in many non-prescription pain relievers. They can also be found in combination with vasoconstrictor drug such as pseudo pseudoephedrine for sinus related preparations or with antihistamine drugs for people with allergies. While the use of paracetamol, aspirin, ibuprofen, naproxen, and the other NSAIDs concurrently with weak to mild range of opiates has been said to show beneficial synergistic effects by combating pain at multiple sites of action. Several combination analgesic products have been shown to have few efficacy benefits when compared to similar doses of their individual components. Moreover, these combinations analgesics can often result in significant adverse events, including accidental overdose, most often due to confusion that arises from multiple components of these combinations. The alternative medicine for NSAIDs, there is some evidence that some treatments using alternative medicine can relieve some type of pain more effectively than placebo. The available research concludes that more research would be necessary to better understand the use of alternative medicine. The next point is uses of NSAIDs, means uses of analgesics. Topical nonsteroidal and anti-inflammatory drugs provide pain relief in common conditions such as muscle sprains and overuse injuries. Since the side effects are also lesser, topical preparations could be preferred over oral medications in these conditions. Also, there are some analgesics side effects of analgesics, but they can cause side effects and complications if you use them too often, for too long, or in very large doses. There are some side effects like damage of internal organs such as the liver or kidneys. The next one is diarrhea or constipation, the heart problems, hypersensitivity response, which is like an allergic reaction, and the commons are nausea, upset stomach, or heartburn. And the anal- analgesics are medications that relieve pain. The uses of analgesics are used to relieve pain and inflammation. For example, analgesics are used after surgery due to a injury such as fractured bone, for acute pain such as twisted ankle or headache, for aches and pains like menstrual cramps or muscle soreness, For chronic painful conditions such as arthritis, cancer, or back pain, also use analgesics.